my name's Michelle Ray, as Melissa mentioned. This is our second presentation that we've done on returning to the workplace. We did it last week, and last week we did not take a few minutes of time to kind of go through to see where people are. And Melissa and I thought it was important because we want to recognize that we are all in a different place and different space. Okay, in terms of what does our actual physical workspace look like, in place in terms of, are we going to go back into the workplace? Have we been in the workplace the entire time? Because we do have data members who have been at work and who are serving the public, particularly in a healthcare capacity. Are we not going to return for a longer period of time? So we all look and feel different, and it really is to your business and to the operation of your business in terms of what decisions you make. Today, we're going to focus a lot on how this impacts your organization from a people standpoint, and particularly in HR, and what requirements are there, and where you may want to be a little bit careful and thoughtful about the decisions that you make. I do want to start out by saying that neither Melissa nor I are attorneys, okay, and this is not legal advice. We do collectively bring many, many years of experience in HR, and so you are able to speak to these, but certainly if you get into any sticky points in your own organization, you will either want to seek your own legal counsel or through your own HR office or consultant or whoever you use. Okay. All right, so things we're going to talk about today is one, just kind of considering, as we return to work, what's important. Talk about safety. So you're going to hear that a lot today. There's going to be three things I talk. I'm going to repeat them over and over. And that is safety. Safety is high up there, as well as being consistent and being flexible. You're going to hear that a lot today. We also want to prepare you for what you may see over the next few weeks, or maybe even you've already started to hear this from your employees in terms of employee relations issues, questions that come up. I do service a number of nonprofits and small businesses in the Mid-Atlantic and particularly in Delaware as well. And we're starting to see these things. I may give you some examples, certainly with eliminating, anything confidential, not to disclose who they are. And then lastly, we will take questions, but if you have questions along the way, feel free to raise your hand. If we can see you, just chime in. You can unmute yourself, it's fine. And we're happy to address them at that time. I know it's about 10 minutes after 1. We are going to do our best to end at 2 to be respectful of your time. And I know that we both have other things this afternoon. Okay. All right, so let's talk a little bit about just when we're thinking about returning to the workplace. The one thing I want to mention is that we put these slides together over the last week or two. Things are rapid, just like when COVID first started, things were changing, I felt like by the hour, and things are slowed down a little bit, but things are still changing. So we did see, new things come out this week. We're going to continue to see new things come out, but this is information that we put together that's very general in nature. But we want to, I don't think we can stress enough that you want to continue to look not only at federal, state, and local guidance that is coming out. And we do have a slide here in a few minutes that will link to some what we feel like are very important websites that you may want to reference. And I know that Dana has also done a very good job about putting out information. So just keep in mind that this is information as it is today, right? And things can and will change as we move forward. So federal, state, and local requirements are really important. Last week, I don't know about on the call today, but last week we had organizations that, although they were in Delaware, they had offices and or employees outside of Delaware. So in Pennsylvania, New Jersey, Maryland. And so that's also something that you will want to consider as you're making decisions. It's just, it's about all of your employees and all of your, the works places that you have, or the locations. So we are going to look in particular today at ADA. We're going to talk a little bit about FMLA, Family Medical Leave, the FFCRA, which was the Family First Response Act, which we talked a lot about. I feel like it was a long time ago, but maybe it was like, I don't know, 60 days or so ago. OSHA, talk about OSHA, that's when we're talking about safety, which is, as an employer, it's your responsibility to provide a safe work environment for your employees. And then we'll talk also about the CDC and the EEOC, which we'll get to. All right, so in terms of considerations, location, again, that's gonna be very important. It's really gonna depend on the location of where you're at. Are you in a hot spot? Do you have an office or employees in hot spots? So you'll need to think about that. Your industry, right? So I did hear on the call today that there are organizations that are very, very public facing. So we have, we have that and we have organizations that are kind of behind the scenes. Their employees are in office space working behind a phone or a computer. That's very different if you don't have a lot of people coming into your office versus if you are open to the public and, you have people in and out of your space. Your floor plan is going to be really important when you talk about that. Your office in terms of shared, I heard a little bit ago about people are sharing offices. So we're going to talk a little bit about that. You may be also in a very open space where you've got pods or desks, you're not in offices. So that's important. The size of your workforce is important. It's very different. We're talking about, 2 or 3 people versus, 50 to 100 plus people kind of coming through a building or a floor or an office. And then again, we've already talked about the workforce itself. Okay. So this is the slide I referenced a few minutes ago. I would save this, and I know we've referenced this on the Dana website as well, but I'm assuming some of you are already, you've been on the CDC, you've been looking at OSHA, the Department of Labor, the Delaware, the governor's website. These are all websites. I know that I had them all bookmarked and I get alerts from them. I mean, that is where you're going to find the best information because they will update these websites and this key information as it pertains to employers. And so I would encourage you, I know it's a lot, and we do realize that all this information is a lot to absorb. But I would encourage you to either, if it's not yourself, designate somebody within your organization that is kind of keeping up with this or getting alerts. And that, again, could be through Dana or be through other means. Okay. All right, so in terms of safety, that is what, when it comes to human resources and to employees, it is your obligation as an employer to provide a safe work environment. And that was long before COVID. I mean, OSHA has been around a very long time. We all know, that is something that we live by, that employees want to feel safe when they're coming to work. And when you add COVID into it, that's where we have to look at, are we as an organization reducing the transmission of COVID-19 in our workplace? Okay, we cannot control what happens outside of work, but we can control what happens in our own environments, or at least try to mitigate as much as we can in our own environments. So we're focused on reducing the transmission, maintaining a health and safety, safe work environment, which in turn, if you can do those two things, you will be able to maintain a healthy business operation. So as leaders of your organization, we believe that's really important and should be a priority as we think about going back to into the workplace. Okay, the next 2 or 3 slides are on OSHA, and I don't want to spend a ton of time on OSHA. I'm going to give you the key nuggets, and we do have quite a bit of text on the slides that are coming up, but the intent there is to give you resources that if you want to share this information in your workplace or you want to go back to it to refer to it, it's there. But OSHA itself, again, involves safety, occupational safety and healthy, safety and health. You want to make sure, and we're all going to be in a different place in this too, is where I should start. Folks who are in the healthcare industry and serving that healthcare environment, your OSHA requirements are much, much stronger and more rigid than if we are working in a office space or if we're also having employees work from home, because we need to be mindful of our employees who are working at home as well. Melissa, I'm just going to pause real fast. Can you see the people that are coming into the waiting room, or do I need to keep adding them? I'll just keep adding them. Okay. All right. So in terms of OSHA, engineering controls, and some of this you own your building or your space, so you're going to be mindful of it, or you're going to be looking for your landlord or the building owner to be responsible for this. So we're talking about air filters and ventilation and physical barriers such as the sneeze guards. I mean, many of you have probably been out to the grocery store, to the bank, and you're already starting to see the kind of these plastic shields, and those really would be for those organizations that, again, have the public that are coming in, people are in and out of your space versus just a few of you who are in the office. Administrative controls, that's probably where most of you are right now in terms of looking at, how can you, when you think about bringing your employees back, implement social distancing? I mean, we are by creatures, very social people. And we like to hang around the water cooler or in the break room or in the common space. So you want to think about that as you start to come back. Travel, I'm assuming that everybody has stopped travel unless it was essential, but those decisions are going to start coming up about whether or not, the employees need to start traveling again, and at what point do they, and how can you maintain a safe environment for them to travel. And that would include, any education or training opportunities that they have to go to. And in general, just promoting safe workplace habits while you're in the office. Okay. PPE, this has been a very popular one. In fact, I had 2 conversations yesterday with companies about this in terms of what do I need to provide? Am I, as an employer, obligated to provide PPE to my employees? In the state of Delaware, we are still wearing masks, and most people have masks. But if you are asking your employees to come back to work, you need to be prepared to offer PPE. Okay, so and then I think you also need to decide, you are in your policy, are you going to allow people to wear their own? Are they going to be wearing the ones you provide and supply? Again, that's going to depend on your industry. If you're in healthcare, your PPE requirements may be a little bit different than those of us who are perhaps sitting behind a desk. Okay, so PPE, I know I saw yesterday, Dana put out that great link that's on the governor website, I believe, Paul, that's linking to cleaning supplies and PPE and different things that you may want, suppliers that are selling these items. In fact, I had already referred it to 2 people who are ordering PPE for their employees. So that needs to be considered. You need to think, and I've talked about this, but again, think about what are you going to do about people going to the restroom, right? Do you have one restroom for everybody? Do you have a restroom, like the larger restrooms, how many people can go into it? I know that sounds silly, but you do need to think about that. You don't want 10 people going into those large restrooms at one time. The kitchen, are you going to allow, this gets really technical, but are you going to allow your employees to bring their food to work? I had this conversation yesterday. I have a group they're going to have if you want to bring your lunch or dinner to work, you have to bring your own cooler, and there's no refrigerator or microwave available. And that's because the cleaning, right? The transmission of opening the refrigerator, opening the microwave. And so for the phase 1 of going back, they're not going to allow their employees, they're just going to unplug those appliances and not use them. So that's something to consider. Conference rooms, are you going to be using your conference room, or is everyone going to be in one location, hopefully at their own desk, not sharing desk and space? And then we've talked a little bit already about travel. Okay. All right, the last thing I'll say about OSHA is that COVID-19 is you do have to record and report COVID-19 if it is in your workplace. So if you have an employee who comes to work and they have a confirmed case, or they believe they got they were transmitted through maybe a coworker, then that needs to be recorded. If it's any time away from the office because of either a diagnosis or treatment, that needs to be recorded. Where I think it gets a little gray is, did the employee actually, the COVID-19 was transmitted through work and their coworkers, or did they bring it in from outside, but then they weren't diagnosed until a few days later, and then they're not really sure where they got it? You're going to err on the side of caution, and if you have an employee who's been diagnosed, you're going to record it on your OSHA log. Okay. All right. Okay, so this one, I'll go through a few of these. These are as we think about providing that safe place for your employees to come back to. Yes, go ahead, Paul. Oh, I might have to unmute you. You're muted.
Sorry,
Okay.
quick question.
Sure.
Was this a place where you referenced workers' comp as well, or is that?
I think I'm gonna get to that. Mm-hmm.
Yeah, sorry.
Mm-hmm. It's a great question. Yes, and COVID-19 can be workers' comp. Okay, so basic prevention measures for the workplace. So when you think about, okay, when we're coming back to work, what are things we need to think about? I would encourage everyone to develop a plan. And this plan could be in a Google Doc. It could be, several pages. Get something in writing and get something documented in terms of how you're going to safely bring people back to work and what your plan's going to be and we're going to get to a few of this in a minute, but are you going to do temperature checks? What happens if someone is diagnosed with COVID? You need a plan. And there's lots of plans out there. I'm starting to see templates everywhere. I'm happy to share a few that I've done. I'll just take the company names off, but you need to get something in writing. This is not something where you kind of want to just, fly on the go. Get something in writing, know that it could evolve. Phase one, initially going back may be different from phase two and then forward, but have something in writing and designate someone to be kind of someone and or people. I would recommend at least two people to kind of be the leader of returning back to work. And it doesn't have to be you, by the way. It could be somebody else on your team. You want to be flexible as much as you can. And I think that's really going to depend on your operation and your organization. There are some organizations, and I just heard someone say you're not going back to Labor Day. I have some clients that are not going back into the workplace until January. That's because everything their employees can do can be at home, behind their computer, behind the phone. But there are some of you who you need to get your employees back to work. But as much as you can, I would encourage you to be flexible. You're going to modify your workspaces and floor plans and layouts if you can. You're going to promote frequent and thorough hand washing. And I know we've all learned about hand washing. I've learned more about hand washing in the last 3 months, but I don't think that we can learn it enough. And there's a lot of great resources out there that you should be posting them around your in your workspace and in your building, in the bathrooms. We're talking about hand washing, hand sanitizer, coughing into your elbow versus your hand. Get those notices up so that people are constantly reminded about them. That's going to be very important. More than anything, employees who have an active diagnosis or symptoms need to stay home. Okay, that's it should not even be a discussion. Eliminating sharing of phones, desks, and offices or office equipment. So if you have a reception desk and multiple people are answering the phone or the copier, you really have to kind of walk through your space to say, okay, what are people sharing and what are people not sharing? And we want to eliminate sharing as much as possible. You want to maintain cleaning and disinfecting practices. So are you having a cleaning crew come through? How often are they coming through? And knowing that it's expensive to have, if you're not having them regularly and you haven't been, can you rely on some of your employees or your task force or a committee that they're, maybe wiping down the doorknobs or the sinks in the bathroom at the end of the day or whatever it may be. And again, there was a great link to cleaning supplies that was provided yesterday. You want to develop in your policies and procedures, you want to talk about how you're going to handle employees who have been diagnosed or sick or have symptoms, and we'll talk about that soon. And then I've already talked about, making sure that you have a lead employee. I would say at least 2, because someone may be sick or may need to be out of the office, but at least 2 people who can help manage this whole return to the workplace. And I can't stress enough, it does not have to be you as the leader. Okay, it can be somebody on your team. Okay. All right, so let's talk a little bit about employee relations and how all of this is going to pertain to your employees. And we're going to reference the EEOC. And the EEOC is really looking at, do you have sound employment practices? Are you violating an employment law? Are you discriminating? Are you treating people unfairly? Are you retaliating against employees? So we want to be very careful when it comes to the decisions that we are making. So as an employer, you're before you go back to work, before you recall your employees, one of the very first things you need, and once you've kind of assessed your space, you need to think about, okay, am I going to ask my employees to do a health screening? And or my visitors, because I hear that there's the public can also come into your workplace. And if I'm going to, what does that look like? Am I going to ask for this health screening every day? Am I going to ask for this health screening just when we return? Are employees going to be filling out something every day, or are we going to ask them to kind of self-screen at home before they come? These are real questions you have to ask. And when you make a decision about what you're doing, you have to make sure you're being consistent. So what you may be asking your employees are, have they been tested for COVID-19, and are they willing to take a test? Daily temperatures. Now I do notice that we have 100.4 on here because that was more of the federals. In the state of Delaware, I believe it's 99.5. You'll see different things out there. That's a decision you're going to have to make as an employer. But are you taking daily temperatures? Are you asking your employees to take their own temperature? Because I have heard some of that lately. Again, are you having a questionnaire for your employees about have they had symptoms? Have they traveled? Have they been exposed? And for any of your employees that you are aware of, either prior to coming back into the workplace or once you're back, if they've had COVID-19, are they getting a medical certification from their doctor releasing them? There is not, there's no right answer for this. This is, and when it comes to these screenings, I mean, this is a decision that you're going to have to make as an employer. And it's what's right for your organization. Now, if you're in the healthcare space or in different industries, you may have to do these things. But for the general office space, you're going to have to decide. But the important thing is that you need to be consistent. And that means that if you're taking temperatures every day, you're also taking your own temperature. Okay. If you're asking your employees to fill out a questionnaire every day, you're also filling out that questionnaire. So I've been doing physical therapy throughout COVID-19. And every time I go to the PT office, they ask me to fill out the questionnaire, and it's the same questions over and over again. It keeps asking me if I've traveled outside of the area in 14 days. I'm like, well, I was just here 2 days ago and I didn't travel, right? But they're required to have every one of their patients fill it out, and it's important. And they're keeping these records because they've made that decision to do this. So this is a sticky one and a tricky one. And I think that, you need to talk to your board, you need to talk to your leaders and make a decision about what's best for your environment. Okay. I'm going to pause there because this one does bring up questions. So if anyone has questions about these. Anyone? Okay. The last thing I'll say about the health screening is if you are going to do a health screening, then I would encourage you to make sure that you are sharing this information with your employees before they come back to work, right? This should be part of your plan. So when you say, employees, we're coming back, effective June 15th, this is going to be the requirement in order to come back into the workplace safely. Oh, and by the way, these are the safety measures we've put in place for you to come back. Okay. All right.
I would just add here also, if you are keeping those documents or you're having somebody do the temperatures, make sure that they are the person who's going to keep it confidential. Mm-hmm. Particularly if, hey, we're sending Susie home because her temperature's high, or she wrote this on her test, and make sure those documents are kept outside of their normal personnel file. They're medical, so they need to be separate. So just make sure your process honors the privacy and that the person who's helping you understands their obligation.
No, that's an excellent point. And from a legal standpoint, again, we said we're not attorneys, but from a legal standpoint, you also, if you're going to do the screenings, then keep a record of the screenings. Don't do the screenings and then at the end of the day, throw them away, because you could run into a situation at some point where, Jane says, well, I was the only one that was required to do a screening every day, and Joe and Bob weren't required, and why did I have to do one? So you don't want to get yourself into any sticky situations with that. So if you're going to do this, if you're having your employees do the screenings, and it could be paper. I have somebody who's doing it on a Google Drive. They have a Google Doc, so the employees are just going in and doing it right from their phone and their computer. Then make sure you keep record. Okay. And I would keep record through this COVID-19, and then at some point somebody will come out, I promise you, that will say, okay, record retention, you don't have to keep this anymore.
Did I miss something when you said, what if the employee refuses?
Oh, thank you so much for, no, you did not miss that.
Okay.
We're going to move that to the end because that will come up again. Yes. And
Okay,
that is, we're
you.
starting to hear that. Yes. Okay. So let's talk a little bit about symptomatic employees. Again, this is another sticky one because symptoms can, there's a variety of symptoms, right? So it is the fever, it is the cough, it is the respiratory, it is the flu-like symptoms. These symptoms can mirror a number of things. They can mirror allergies the allergies are terrible right now, or any type of other type of bug or the flu. So, we want to look at what are the basic symptoms of COVID-19. And if someone is exhibiting those symptoms, regardless if they have it or not, you need to send them home. So if someone is coming to work and they are coughing and sneezing and they're like, oh, it's just allergies, you want to send them home until they can document from a medical provider that it is just allergies and it is not COVID-19. Don't put yourself in that situation where your other employees are feeling unsafe because they have their coworker coughing and sneezing, and or the employee is just guessing that maybe it's just something else outside of COVID-19. So you need to monitor the symptoms. That's really important. And once someone has symptoms, then when can they return to work? And I would say that's generally, you want to look at both the CDC guidelines, but also if it was one of my employees, I would be asking for a doctor's note indicating either one, they've been tested, or two, they've been diagnosed with something else. Okay. If your employees have a confirmed COVID-19 diagnosis or they've been exposed by someone who has COVID-19, then it's important to maintain their confidentiality. Melissa did refer to that a few minutes ago when we were talking about the health screenings. So confidentiality is going to be important, but just realize that you may have some employees who may openly share that information. So very early on, I had some clients who were in healthcare and they had employees who were diagnosed by COVID-19, and they shared with their coworkers in a way that they wanted to make sure if their coworkers had been around them, that they were aware that they had it. So that is up to that employee to share. That is not up to you as an employer to share, okay, in terms of who has it. Notifying health authorities if you need to. You definitely want to make sure if you have a COVID-19 diagnosis or exposure in your workplace that you are shutting your office down and you are cleaning and disinfecting. And then what Paul referred to a few minutes ago is we are starting to see if COVID-19 is transmitted in the workplace, then they could be eligible for workers' comp. Again, that's going to depend on your where you're located, your workers' comp carrier, and so you would work through your insurance company on that. All right, employees concerned about returning to work. I could almost guarantee that you are going to have employees, at least one, if not several, and it could even be you on the phone. You're going to have employees who are concerned about returning to work, and I think this is there really is a difference about being fearful about returning to work because they're fearful or afraid of being COVID-19 being transmitted, or there is an underlying condition there that makes them more susceptible, or they have a health condition, and those are two different things. If there is a business need for that employee to return to work, because your business is requiring them and they are no longer able to work from home, or you're not letting anybody work from home, that is, it's a different conversation if the person is just afraid to come back to work or if they have a health concern. If they have a health condition, that is treated differently than just being afraid. I mean, at some point we all, we can't all be afraid of going back to work. And if your job requires you to go back to work, then that is a business decision you're going to have to make of whether or not you're going to release that employee from work. And we have started to see that a little bit. Okay. But if there is a health condition there, they are going to be covered potentially under ADA. They could be covered under EEOC. There's lots of legal ramifications. So you want to be very cognizant and aware of that, and make sure you're getting documentation from your employees if that does exist. But again, let's go back to being flexible. Let's go back to being consistent. I can share. So I have a client that they recalled everybody back to work from furloughs. They had 3 employees that said, don't want to come back to work. I'm afraid, I have a sick kid at home, and I'm carrying, I have a health condition. And the important thing was that they were all treated consistently. They were all asked to get a doctor's certification as to why they could not come back to work. They were all given the same time. Okay, we need a doctor's note by X date. And then if they were not able to produce that doctor's note, then they were all treated consistently. If they were able to produce the doctor's note, then that's different. And that's when other benefits could play into this. Okay. But let's be flexible more than anything and be consistent. Okay. So in terms of handling employee issues as they come up, I think that, again, I would encourage you when you're thinking about your plan and how you're recalling employees, over communicate as much as you can. In fact, if you have an all hands or a stand, some folks have a stand up, every day, a 5-minute or a phone call. I don't think you can communicate enough about what your plan is about returning to the workplace, how you as an employer are are ensuring employees' safety, and what they need to do in terms of what the requirements are. So communicate, very important. Provide training and education, that's important. So if you are asking employees to do health screenings, then you may want to actually have a training about how's the health screening going to look. Are you asking them to do it? Are you doing it? And how is that going to take place? If employees have concerns, again, are afraid or fearful, have questions, where are they going to go? Who is the point of contact? Who do they need to speak to? And you want to encourage that dialogue. Do not retaliate against concerns expressed. So if someone says, I'm afraid of work, fearful of work, or fearful of coming back, don't automatically take them off the schedule or eliminate their position because they've said that. Have a conversation and a dialogue with them and get to really what is the underlying cause of them being fearful. If you have an EAP, hopefully you've been sharing your EAP. Employee assistance programs are, they're needed now more than ever. Not only COVID-19, but the other, lots of different things are going on in our world, and our employees are stressed. Their mental health, has really is, for some people are suffering in that area. They need resources when it comes to their family or to their kids. So if you do not have an EAP, I would encourage you to think about it. There are companies who are offering EAPs, particularly for nonprofits, at reduced rates. If you have a long-term or short-term disability provider, there are those ancillary benefits. Sometimes you can get even like a basic EAP built into your plan. So I would encourage you either to have one and definitely be sharing it. It's almost like washing your hands. I don't think you can share that EAP information enough. And I think they're really needed right now. And then again, we're flexible and we're being consistent. All right, so let's talk a little bit about questions that may come up, and then we want to open the floor for questions. So I want to address the one we had a couple of slides ago that said if an employee refuses the health screening. So if you identify and you have if you identify that you're going to do screenings either every day, every week, when they first return, whenever it is, if you're making that decision, and you can do screenings. I mean, it is a right as an employer to do these, and you have communicated this to your employees, and you have an employee who is not willing to participate in the screening unless they have either a medical documentation or a valid reason as to why they wouldn't, and I'm really trying to think of what that would be, then you will, that is part of returning to work, And if returning to work is part of the requirement of the job, then they must do it. And if they don't, I think you as an employer, you could take the next steps in terms of discipline, and that discipline could include termination or removing them from their role. Okay, that's a harsh one. I know it's hard, but if you've made the decision to do the health screenings, then that is important to you as an organization and your employees. If you've communicated it and you've given people are understanding why you're doing it, then I think it needs to happen. Again, you need to be consistent. So if someone refuses, don't let them off the hook, but then make everybody else do it. Okay. We've talked a little bit about safety, about returning to work, so I'll skip over that. This second bullet, we are seeing this quite a bit. People who would, they'd rather stay at home, and they're not going to tell you that they want to stay at home and be on. And these are for your employees that you've furloughed and they're on unemployment. And I don't know if anybody on this call is in this situation, but there are many who are. If you are recalling your employees back to work, you're opening up your business, then your employees need to come back to work. And if they're making the decision not to come back to work, then I think you have to make a hard decision about if you're eliminating their employment, separating their employment. They cannot stay on unemployment if you have made the decision to bring people back. I've dealt with at least a dozen of these cases already where people are just gonna let it ride out. They want to stay at home through phase 1, maybe through phase 2. Unemployment's not so bad, but these businesses they need employees back to work. And if you're in that situation, then you need to make the right decision about what to do. But again, be consistent with everybody. Okay.
And I think the other thing is, if you offer them employment, I would make sure to document it in writing. Susie, we want you to return to work. And if Susie says she's not returning to work, that she also documents it in writing via an email to say, I'm choosing not to return to work. You want that documentation, because in case you are ending her unemployment, you want to be able to have we offered it to her. Mm-hmm. She is choosing not to come back.
Right. Yeah.
Protect yourself.
Yeah, and I will, I'll be very transparent. I have not seen what the Department of Labor is doing in these situations as of yet. So I do have a few cases where employees have made the decision not to come back to work. So then they were separated from employment. And whether or not the Department of Labor has kept them on unemployment or not, that's not a decision that we all make. Right, the Department of Labor makes that decision. As an employer, what your obligation is that when you get that notification from the Department of Labor about if your employee, you'll receive a notice that you have to fill out. You will document on there that you recalled people back to work, and Susie didn't come back to work. And that's really all you need to do, and then the Department of Labor will make the decision. Okay, I'm gonna pause for a few minutes, and I know last week we had a lot of great questions, and if they're specific to your organization, we do have time, about 15 minutes or a little bit more just to, so we'd like to open up the floor. You can certainly ask any questions you have. Don't be shy.
Hey, Michelle.
Hi, Tyler.
I was speaking earlier about how we were moving in different phased approach. The first one, non-mandatory to come back to the office. The second one we were thinking would be mandatory to come back to the office, and we're not quite sure about timing as of yet on it. But could you just speak, and I know you've addressed this a few times, being consistent. Could you just speak about if someone doesn't want to move into phase 2, that mandatory come back to the office phase, outside of just being consistent with how you do it across the entire staff? What do we need to be concerned about?
Yeah, sure. Yeah, so I would start probably by thinking about it as a team or with your board in terms of what led to that decision to make it mandatory that everybody return, right? And everyone's in a different place. Right. There are going to be some people who say, my employees are productive at home; they can do their work at home. But we also know that some employees aren't productive at home. Right? There's been a lot going on. People are homeschooling, and now we're looking at, at summer, and that's not to say, it's just for the people who have children, okay? Because there are some people who don't have children who also are not productive at home. Right. But if you've made a decision that everyone, must come back to work, then there needs to be a really good reason as to why someone wouldn't come back. And there could be lots of them. And I think you're gonna have to really take it on a case-by-case basis. So again, we're talking the medical, so they could have a health condition that makes them much more susceptible. I would say doctors are being pretty strict about this, at least from what I've seen, because we've requested some doctor's notes for some employees, and either because of their own health condition, or what we're also seeing is employees have children at home who are susceptible. Maybe they may have children with significant medical issues, right? And I would say more often than not, the notes that doctors are not necessarily giving out those notes excusing them. So, and which I think says, I take it for what it's worth, but, so that could be playing into it. Remember that family first. So if you are over 50 employees, right, and you have an employee who needs time off to care for a child because either school or daycare or camps or whatever are closed, they could qualify for that. They could qualify for medical leave or FMLA. So there's a lot of things that to consider, and I think you need to get the whole story. So I'll give one example. Had an employee who says afraid to come back to work, not coming back. That was the example I gave of the 3 people. And so again, asked him to provide a note. He did not provide a note. Because everything is available through technology. We do know he's golfing every day because someone could see it on the app, right? And we see his name. So it's neither here nor there, but we know he's out in the community.
Right.
We again ask for a note. We give him a deadline. He does not meet that deadline. We separate employment. We get a letter from an attorney, and it wasn't that he was fearful of coming back to work. It was in fact that this organization made a decision to reduce everyone's pay by 25%. And he was upset by that, right? And that was really the driver, because he didn't want to come back to work because he was getting paid less to come back to work to do the same job he was doing before. So sometimes there are things behind, and I give this example because there's sometimes things behind it that your employees aren't necessarily going to divulge, right, in the moment. So I would do the best you can to ask questions, to give them an opportunity to support them without, going too deep into as an employer, what your obligation is.
The one thing that I would just suggest also, as you think about your phasing, if you have a phase that you're calling the required return to work or workplace, really think about it. Is that the right long-term answer for your organization? Is that really the mandate, or do you want to have some level of flexible work arrangement? Like whether it's, because it doesn't have to be an all or nothing. Well, your organization doesn't have to have an all or nothing policy. There may be some roles that are all or nothing. Like if you are the front desk greeter,
Right.
that's probably in the office all the time job. But there may be others where you're able to provide flexibility. So this is a perfect time just to revisit what are our parameters. What kind of employer do we want to be going forward, knowing, some people were really successful working from home, some were not, but like, what do we want to show? How do we want to be perceived as an employer going forward? So just be careful about the all or nothing switches unless you really have an all or nothing requirement.
Yeah, that's really important. And just because things are opening doesn't mean we have to open. I would say that. And to the point, Melissa, so I have a client that has made a decision to shut the office completely for 1 year, and everybody will work from home. And they employ quite a few millennials who are just very socially, they all go out after work. Not that they should be going out after work right now, nothing's open, but they crave that in person, and working from home has been very difficult for them. And closing the office really has, from like an emotional well-being and mental health, has really hit a few of their employees very hard. So now they're kind of wrestling with that, like, what do we do? What can we do to provide, can we do a WeWork or a shared workspace, or can we, have a small space that some of our employees can come back, because not everybody is comfortable or equipped to work from home. And if you're asking people to work from home, listen, we were all kind of forced to work from home, like on a moment's notice. But I mean, I still have clients that don't have printers. at home. You know, they don't have proper equipment. They're working on their sofa versus a desk. So these are all things that if you're going to allow your employees to work from home kind of ongoing, you know, you need to make sure as an employer that they are equipped to work from home.
One of the other things that I would bring up also is getting their input.
Mm-hmm.
Because if they feel part of the parameters that were set to come back, it's easier for them to return and buy in and say yes.
Mm-hmm. Yes, if your organization allows that, absolutely. Yeah. Yeah.
Are there any updates to the labor law posters that we need to post?
Nothing new has come out right now. The last one that came out was in regards to the Family First Response Act, but nothing else has been published. No, doesn't mean it won't tomorrow. But I haven't heard anything. No, I haven't heard of anything on the horizon. But that's a great question. So we have some chat. Let me just see if we have any questions here.
Any other questions, concerns, situations you want to highlight?
Yep, I have one. This is kind of next level, and it's in progress. So the guidance would be for the employer, where an employee, so this is an essential workplace. The employee goes out due to COVID, is ill, and is now out about 6 weeks. And so the employer is starting to get this feeling that they might be taking advantage of the situation. The employee might be taking advantage of the situation. In terms of, she has been asked to be retested, get a note from a doctor, those kinds of things, and there really is kind of not much momentum. What kind of guidance can I offer the employer to make sure they stay on the right track?
Mm-hmm. Great question. So it depends. It's really going to depend on how large the organization is, right? So if they're over 50, do they qualify for FMLA? You know, I think you said she had COVID. He or she had COVID-19. They've been out for a period of time. You know, if you've asked for one thing, more than anything, the important thing here is going to be documentation, right? So whatever. If they've had a phone call, it's following up with an email, you know, outlining what the phone call's been. I would probably send a letter, or, and knowing that if someone's out for work, they may not necessarily be checking their email, right? Or if we've furloughed employees, they shouldn't be checking their email. That's been coming up. So you make sure, however, you're communicating that they're actually getting it. But documentation is important. And if you've asked for a doctor's note, you probably in this case want to be a little bit more lenient, say, okay, I have to have a note by Monday. Monday comes, okay, I'm giving you until Friday. After Friday, we need to take further action. Because if they can't provide a doctor's note, then there might be something else going on there. And you as an employer, you know, if they're not covered under FMLA and the doctor hasn't said they need to be out longer, then you could, especially if they're essential, could take that next step. The documentation is so important.
Yeah, and depending on the employer, whether they have a short-term disability policy or long-term, like they're going to need a doc. Like out that long and not be going to the doctor sounds a little bit suspect. And so I would go with your gut that it sounds a little bit suspect, and just, you know, really make sure you're following through and understand what those actions are, because by letting that individual go this long without it, you've now set a precedent that the next person would be like, well, she stayed out for 6 weeks without a doctor's note. Why can't I stay out 6 weeks without a doctor's note?
Yeah, there's probably something else there. Yeah.
Thanks.
Sure.
Any last question? About 3 minutes left.
And we have the slides that are posted, right, Paul? We post the slides, we post the links, and then, you know, our information, if anybody has any, questions, we're happy to do any follow-up as well.
The slides are not posted.
Oh, they're not posted. Okay, I'm sorry.
I did send them out to everyone.
Okay, good. They're provided, I should say. Great, thank you.
Well, thank you all for joining us today. And obviously, if you have questions, you know where to find us. But best wishes it is a
Mhm.
tough time. You have a lot of other things that have happened on top of this right now that you are, I'm sure, dealing with in your workplace. So, take care of yourself, because you have to do that first so that you can take care of all those other people that you are now responsible for. So, or you've been responsible for. So take care and let us know how we can help.